Hey guys, so we are going to talk today about the Holistic Behavior Prevention Program, where it's a lot different than other programs because we're focusing more on the whole person versus just exactly about taking the patient down that is already in some form of hysteria, that is having delirium, that is having acute mental illness, or even addiction. It is vital that we acknowledge some of these things because if we don't, then we've not only we've missed a step first and foremost, but we have also done probably more damage than we should in regards to the anxiety, the trauma. You need to do this, you need to do that, Mr. Smith. It's very important that we acknowledge also within ourselves that what can we do better. So the holistic behavior prevention program is not just for patients and the patient nurse interaction, but it's also as a whole, as a healthcare system of how we could do better in regards to how we treat each other, how we treat ourselves. And then also that also comes into play with our relationships with patients and their families. And, with the exuberant workload that we have, how are we going to get better? We have a profession in nursing and frontline healthcare workers that is literally suffering because of all of the trauma, all of the different factors of the pandemic. And we also have, the housing bubble and the homelessness and addiction that we're working with still to this day, from all the way from 2008 to 2011. We're going to dive right in and we're going to get some more of this out so you can be more aware of everything that's going on. You're going to be educated with the gaps of care, including the stuff that you probably did not learn in nursing school in regards to what's happening today. And you are going to be empowered by this information that you're going to prevent any issues before they even happen. Can we prevent all issues? No. But we can certainly look within not only what we could do on the unit, but what we could do within ourselves and the things that we are not aware of that we never knew. Right. So I am excited to be able to share this with you. We're going to go on to, what is what is the next step? We have our purpose statement for this program, whereas to bring awareness to a deeply rooted problem that's affecting frontline healthcare workers who are suffering epidemic levels of psychological and physical abuse every day.